Hello and good day to all of you. My name is Kanika Vidanage, and I am a senior lecturer in the area of in the discipline of artificial intelligence attached to Sri Lankan University. So here I am providing a reflection of my ResearchGate profile as a means of credibility and just to ensure the trust uh, about the person who is conducting this video elaboration. So the main purpose of this video elaboration is to retrieve some potential constructive feedback about my PhD research work from non-computing specialists. So I am stressing from non-computing specialists like medical doctors, lawyers, bankers, etc. Because my PhD research is associated with getting knowledge from various specialists and developing machine readable approaches to generate artificial intelligence. So I will just eliminate all the technical jargons and I have a very clear elaboration about what I'm going to do. So before moving into those aspects, initially I elaborated about the purpose. Basically I have done close to 32 publications in Scopus and Web of Science index journals in reputed journals. So why I am portraying this information to you, hence as a means of credibility, and the trust has to be developed about myself as the speaker who is conducting this session, this video elaboration. Due to this COVID pandemic restrictions, as all of us are aware, we were not in a position to physically meet and get the required feedback. Therefore, I am anticipating to provide this video elaboration as evidence of my work and to derive some potential feedback. Okay, so let me go into my research discipline. Now here I just have basically utilized a small picture in order to provide a high level view about the research work that has been carried out. Now there are a lot of experts available in various disciplines. Sometimes these experts are having very busy schedules. Think for a medical expert, let's say a cardiologist who is functioning as a university lecturer as well. So because of his or her busy schedule, sometimes maybe let's say medical students might be asking a lot of questions from this expert, and this person might be having a very hectic schedule and might not be able to individually reply to all these emails or text messages or phone calls. So in my approach, actually we are in a position to create a knowledge model by extracting the expert's knowledge. So here we are not using any technical mechanisms like EEG or hypnotizing or nothing like that, right? Basically computer specialist need to fix an interview with the related expert, and we are conducting multiple interview sessions about the concerned subject discipline, and we are in a position to extract his or her knowledge. If it is about, let's say, COVID-19, so we establish several interview sessions, and we ask various questions about COVID-19, its symptoms, vaccination processes, etc. Then the consultants will be providing various answers. Then depending on those answers, we will be able to create a knowledge model. So technical jargon we are using for this term knowledge model is ontology, not oncology, it's ontology, right? So once an ontology is created, the advantage of that is it is machine understandable. That means we can easily link it to a chatbot, right? And the respective individuals can ask questions from the chatbot, and chatbot will reason and provide answers. So it's like an approximation of getting the same experience while having a discussion with the expert. So I will initially provide a small demonstration about such a knowledge model that has been developed for my university. So this is a small elaboration of the chatbot, the knowledge ontology, which has been developed for my university by extracting information from various experts. Now say suppose a student has some queries about various information to be gathered about the university. So student can easily here type, let's say we'll start the conversation, hello, right? So right, so right, okay, you can see now it's responding. In the ash color it is the user's response, and in the blue color it is the auto generated response by inferring the knowledge extracted from the knowledge model that has been created for the university by interviewing various university related experts. So if you say hello, it is responding, hello, hey, how are you, I am blah blah blah, developed by Department of Data Science, Faculty of Computing, what can I do to help you? Now say for an example, if I am asking, what are the courses you offer, right? So it's responding, we offer programs ranging from certificate level up to postgraduate level. Are you looking for a local program or a foreign program? Let me, if I type as local program, right? So we offer UGC approved local courses ranging from BSc in Managing Information System, Computer Science, Software Engineering, blah blah blah. Refer refer website for more information. Do you need anything else? So likewise you can see it has some intelligence, right? So it is capable to answer certain questions. Now if I ask an unrelated question, like say what is COVID-19, right? Now this knowledge model which is being created is associated with a university environment, not with a discipline like COVID-19. So this knowledge is not available. So let's see the response. It says, I am sorry, I have not been trained to answer into that question. I am trained to answer only NSBM course related information only. Please see Google for general queries. However, I will inform about this to my master, right? So you can see it is having some intelligence and capable to carry out a conversation with a human being. So how is this intelligence is coming? That is based upon the interview sessions that we have conducted with the domain specialists. Then that knowledge will be converted into a machine understandable format, or technically to an ontology. So the computer will be able to analyze the user's question and extract the required responses from the ontology. Now if you say if I say bye, right, so it will again respond, it's a pleasure to have a chat with you and help you, have a nice day. So this is a nice small elaboration about how the created knowledge models will be useful in practical environments. Now my research is not about creating a chatbot like this. It's about certain challenges that computer specialists are facing when they are developing knowledge models. Now if you are interested, you can do a Google search and see there are ample of knowledge models developed for medical science domains like gene technology, gene engineering, then pharmaceuticals, and anatomy, likewise in relation to various domains for the knowledge dissemination and knowledge diffusion. A lot of ontologies are being developed, and in computer aided robotics where there are computers who can do surgeries under the involvement and the observation of the consultants. So the intelligence for those robots is being extracted through these means. So basically we interview the related experts, and we get the knowledge, and we convert it to a machine readable format through a knowledge model or an ontology. Then henceforth machine is able to carry out his or her task individually smartly. Now say for an example, if there is a cardiologist and also a lecturer attached to a medical school having a very busy schedule, might not be able to answer into all the phone calls or the text messages, emails may be sent by medical students. So easily, as I depicted earlier, we can create a chatbot like this via connecting the front end of the chatbot with the knowledge base extracted from the relevant specialist. So this is basically done through interweaving process. Now the problem where my research is associated is, now when we are creating, basically we extract the knowledge from the medical specialist through interweaving. Then actually we utilize certain technologies like RDF, Resource Description Framework, SCOS, then Ontology Web Language, to create these knowledge models. I will show you a sample of such a knowledge model that has been created for COVID-19. So the outlook, the arrangement of the knowledge model is something like this, right? So this is extremely technical, right? This is extremely technical, and we have a requirement actually. Once a knowledge model is created, it has to be verified for the accuracy with the involvement of the contributed non-technical domain specialists. For an example, if a cardiologist is involved for a creation of a domain ontology, we have to provide that the created knowledge model for the cardiologist, and we have to get the verification from the cardiologist before releasing it to the production or the public environment. Verification is very important, because otherwise, if wrong information is being captured and created, it will provide wrong ideas, wrong details to the general public, which is going to be very dangerous. Now when we request the assistance of the domain specialists like medical doctors, bankers, lawyers, they are not computer specialists, so they cannot understand a knowledge model created like this, right, which is available in RDF or OWL formats. So it's another discipline for them. So learning these things and giving feedback whether it is right or wrong is a additional technical burden. It's a steep learning curve which is unwanted for a domain specialist. But at the same time, under ontology engineering, it is very important and very crucial to get the feedback of the respective domain specialists before it is being released to the public. Now, why we need to verify? Because here a knowledge transfer is taking place. Now, cardiologist or the respective domain specialist is providing his or her knowledge or the conceptualizations associated with his or her domain. Then that knowledge is being understood by a computer specialist, and it's being converted into a ontology or a knowledge model. Now during this knowledge transferring phase, there could be chances of misinterpretations. So cardiologists might be intending something, but it could have been misinterpreted by the respective computer scientist and implemented in a wrong manner. Therefore, before we release this knowledge model to the public, definitely it has to go through a verification and validation stage with the involvement of the consultant. Unfortunately, we have the challenge, these technical things are not being understood by non-technical domain specialists like medical doctors, lawyers, etc., because it's another scope and it's an unnecessary burden for them. So that is the research problem that I have addressed. So where I came up with a mechanism to propose a platform which can assist non-technical consultants to conduct this verification process in a more effective and a more friendlier manner atmosphere without understanding these technical complexities. So let me show you how my proposed research platform is functioning. So now I have created an ontology or a knowledge model for COVID-19. So I'm executing it now. So now basically an ontology created would be something like this. So we cannot give this to a medical specialist and ask whether it is correct or wrong. Therefore I have come up with an approach, right? Initially I am generating a user guide, right? Through this verbalization process, all the knowledge available in this technical arena will be converted into simple English, right? So details associated with this ontology is being provided as a user guide, which is created in simple English, even a normal non-technical you can understand it from layman terms, right? So henceforth, without not limiting into that level, then I provide a visualization assistance. So let me elaborate that as well. So it's something like this, right? Now this is for the COVID-19 domain. So here we have considered 1, 2, 3, 4 areas in this ontology or the knowledge model, like prevention care, special care, symptoms and vaccines. Now let's, if the medical doctor wants to look into the symptoms, he or she can simply double click on this canvas button. So it will then show symptoms are categorized as common symptoms, special symptoms, emergency symptoms. Then if you want to look at common symptoms, just give a click on this button, right? Then it will tell details about common symptoms. There's another button. If you click on this, it will show you common symptoms are like chills, headache, dry cough, sore throat, body aches, loss of smell or taste, runny nose. Likewise, common symptoms associated with COVID-19 is being visible here. Now here, always compare this output with this technical platform, right? So here it's completely technical, but now it's provided very comfortable platform for the non-technical medical specialist to go through and analyze, understand, right? So it is having a logical taxonomical hierarchy in order to make sense. Now if you want, let's continue further. I want to look into emergency symptoms, right? So what are the emergency symptoms with COVID-19? Like maybe pressure in your chest, trouble of breathing, sudden confusion, bluish lips of face, constant pain, stroke. Likewise, the emergency symptoms are available. So easily the medical doctor can verify whether these knowledge embeddings available in the ontological space is accurate or not. If it is not accurate, immediately it can be communicated to the what do you call, the computer specialist. So computer specialist can make necessary adjustments, and in the next round again a re-verification can be carried out. So now we had a rough understanding about the symptoms. Now if we analyze another segment, maybe let's say prevention care, right? So prevention care is further divided into self measures and governmental measures. So what are the self measures? Wearing of mask, social distancing and sanitization. So if you look into masking, right, under mask you have cloth masks, KN95 masks, surgical masks. So if you look at cloth masks further, right, so we have knowledge is provided as not recommended, right. Then if you look into as KN95 masks, right, it's specified as it's providing best protection, and it helps to regulate the spreading of the virus, right. So there is a contribution for the controlling of common symptoms if you are properly wearing a KN95 mask, because through limiting the spreading of the virus. So likewise you can verify the information in a very logical manner, despite these technical things. So this is the same ontology that I have been graphically visualized with the help of my algorithms. So but this is the technical view. Now earlier doctor has to go through this before the verification, right. So it's really challenging, but now I have provided a very supportive platform for that, which is the contribution, one important contribution of my research. Then say if you want to look into vaccines, right, so vaccine details. So basically in here, according to the scope which is being addressed, we have covered 1, 2, 3, 4 type of vaccines like Pfizer, Johnson's, AstraZeneca and Moderna. So if you want to get more details about Pfizer vaccine, right, so vaccine name is Pfizer. So and it will provide protections after 2 weeks after the second shot, and it's been recommended above 16 age. So these are certain information captured from World Health Organization, and it has 2 shots to be provided, right. So similarly, if you take some information about let's say Johnson's and Johnson's, right, so Johnson's and Johnson's, 2 weeks after the shot, above 18. Unlike in Pfizer, here you have only 1 shot, right. So likewise, very easily, despite the technical difficulties, you can get the information in a very effective manner, right. So the expectation is initially you can get a rough high level idea about the included information through this simple English. It provides the explanation, right, what is an ontology, likewise what is a class. All the explanations are provided in English. Then you can we can provide the hard copy of this to the respective specialist. So during the leisure time, slowly the domain specialist can scan through this, right. So then he or she will be getting some surface level basic understanding. Then we will be exposing the domain specialist to this visualization interface, where that surface level understand can be further strengthened, right. Further, without stopping from the verbalization user guide and the visualization support, we have arbitrary questioning facility module also created, so people can ask questions in normal English. Otherwise, there is a technical mechanism called Sparkle or SQWRL in order to get answers from an ontology. But learning the Sparkle language and SQWRL language is really challenging for a domain specialist, non-technical person. But here you can ask questions very easily, so it will provide responses in an intelligent manner relevant to the COVID-19 domain. Now if we ask what is stroke, now it is not providing a description about stroke. Why? We have not trained, or we have not extracted information about stroke, but in relation to the domain of COVID-19, let's see what is the answer. It says stroke is identified as a emergency symptoms, right? So that is true, right? We noticed in our previous visualization evaluation as well, under emergency symptoms, stroke is being identified, right? So it's providing good elaboration in that aspect. So if we ask, let's say, what is ventilator, maybe, right? But here we have not captured and fed details about ventilators in general, because that is not in our scope. In relation to COVID-19, I think it will try to provide some information. No resource captured. Okay, there could be a spelling mistake. So what is a ventilator? Again, I type the question, right? If we query it, right, you can see in relation to the COVID-19, it says a ventilator is being used for the caring, and under ICU, for patients with ICU care, it is being provided. So likewise, even through this mechanism also, it is providing some assistance to arbitrarily verify here and there certain packaging of the information inside the created ontology or the knowledge model. So rather than going through very technical disciplines for the verifications, for non-technical experts like medical doctors, lawyers, we have created the platform to contribute for the verification process very effectively. So very easily they can provide their comments, and the consultants, sorry, the computer scientists then accordingly adhere to the suggested modification, and re-verifications can be carried out. So this is a very high level and simple overview associated with a specific segment of my PhD research contribution. I have not discussed the entire thing, because then the video is will be getting very lengthy. So I believe this is the type of the expectation that we are expecting from non-technical people for the knowledge model creation, and through literatures we have been able to justify that they face lots of challenges because of these technical barriers. But here my contribution is, I have been managed to provide some facilitation to dilute this technical contribution through this ad hoc simple English response generation, and through the visualization canvas and the verbalized user guide which is being generated. So thank you very much for your contribution. So I would be very kindly requesting to go through this video clip and provide me with a constructive feedback about the sort of convenience which will be available for the non-technical specialist, medical doctors, lawyers, etc., as a through this platform, right? Always you have to compare these facilitation outputs provided in natural English and taxonomical traversal approaches against this raw technical version of a knowledge model. So I have done close to as I mentioned, close to 32 publications in various journals, right? Yeah, you can always refer to my ResearchGate profile and get feedback verify about the work that I have done. So without taking much time, thanking all of you, and anticipate that you will contribute to me in order to get constructive feedback for the demonstrated PhD contributions. Thank you very much. Have a good day.